In this video, I'm going to review Medicare Supplement Plan N and compare the costs and benefits of Plan N to both Medicare Supplement Plan G and Medicare Supplement Plan D. Medicare Supplement Plan N can be your best value for a Medicare supplement. This is especially true in those specific states that have state laws that reduce the value of a Medicare Supplement Plan G. In addition, some insurance companies are already preparing for Medicare Supplement Plan D to become a very popular plan after 2020. Now, to be clear, I'm referring to Medicare Supplement Plan D, not Medicare Part D, which is for your prescription drugs. Medicare Supplement Plan D is a direct competitor to Medicare Supplement Plan N. Do you live in a state that has the specific laws, the Medicare override measure laws that make Plan N a better value? Are you familiar with Plan D at all? Do you know what simple trick or technique to use to tell if Medicare Supplement Plan N is a better value for you than Plan G? We're going to be covering all of that and more in this video, so stay tuned. Before we get into today's video on Medicare Supplement Plan N, you should know that whether you're new to Medicare and researching Medicare for the very first time, or you've had Medicare for some time and you just have questions, my website, MedigapSeminars.org, is where you'll find the answers you're looking for. I've created a series of educational videos laid out in a very easy to follow format that can take you from the very start of Medicare, how and when to enroll, to talk about the different Medicare plans, Medicare Supplement and Advantage, all so that you can make an informed decision when you make your Medicare choice. If you have a specific question and you can't find the answer on the website, then simply press the Contact Us form, complete it, give us your questions, and within 24 hours, a licensed professional agent is going to respond to your email, respond to your question with the answer that you're looking for. So please, visit MedigapSeminars.org. Our mission is to help you make an informed decision about your Medicare choices. All right, so let's get started. Choosing which Medicare supplement plan is right for you can be a little bit daunting. Certainly, when you're new to Medicare and you're just learning the ABCs of Medicare, making sure that you have the right supplement plan for your budget and your needs can be a little bit of added stress. So first off, let me take a little bit of that stress off your shoulders. Regardless of your health history, when you're new to Medicare, you have 6 months to choose the right Medicare supplement plan for you. You can change your mind all you want, every day if you want, for 6 months, and the insurance company is simply required to accept your application and give you the plan of your choice without questions. If you're not new to Medicare, you still have a 30-day window to change your mind. And here's why. Many people will mistake your initial enrollment period for Medicare with the same initial enrollment period for your Medicare supplement. Your initial enrollment in Medicare ends 3 months after your birthday month. Your initial enrollment for a Medicare supplement ends 6 months after you have started Part B, even if you started Part B during your initial Medicare initial enrollment period. So you have 6 months where you can change your mind. You can change your mind every day. You can go back and forth with plans. You can do whatever you choose during those 6 months as often as you want. And the insurance company is required to give you the plan of your choice. You cancel one, get another one. Now, after those 6 months, you can still change your mind all you want. It's just that whenever you apply for a new Medicare supplement, you'll have to qualify by going through medical underwriting. And there, you're going to be asked questions about your health. And they're looking for major things like a heart attack, stroke, cancer, diabetes that is not in control, implanted medical devices, and Parkinson's, and those kind of things. Absent those significant events, then you can still change your Medicare plan anytime you want, any day of the year. So after your initial enrollment period in your Medicare supplement, when you do change and you go through underwriting, you still have a 30-day window in which you can reverse your decision with no consequence. So relax, take your time, make sure that as you research your Medicare supplement plans and which plan is right for you, that you end up with the plan that's right for your needs and your budget. But rest assured, if you're waking up every day worried about whether or not you made the right decision, you can still change your mind during your 6 months after your initial Part B or 30 days after you've made your plan when you had to go through medical underwriting. So I hope that relieves a little bit of stress. Now let's get on to Medicare Supplement Plan N. Is Medicare Supplement Plan N the right plan for you? Well, let's take a look at all the plans and start by talking a little bit about how this plan is different than your other choices. Now in this table, this is your Medicare Supplement Benefits table. It shows all 10 of the Medicare Supplement plans. The plans themselves are identified in the top row by letter. And then the general categories of Medicare benefits are listed on the left-hand column. And then in the column below each of the Medicare supplements, it shows you what percentage of coverage you have. You can find this table on our website or in most of the major Medicare publications like the Medicare and You Guidebook or the Choosing a Medigap Policy. Now remember that regardless of which Medicare supplement you choose, Medicare Part A and Medicare Part B are your primary coverage. That's your primary insurance. A for your hospital insurance, B for your outpatient insurance. Now with Medicare as your primary insurance, you can see any doctor go to any medical facility in the country as long as they accept Medicare. And every facility you go to has to accept any Medicare supplement plan that you have from any insurance company that you've purchased it from. With Medigap Plan N, we can see that it covers 100% of the Medicare Part A coinsurance and hospital costs up to an additional 365 days after the Medicare benefits are used up. Notice that all the supplements have this coverage. And also notice down here that the Medicare Supplement Plan N pays the Medicare Part A deductible. In 2017, that deductible is $1,380 per event. It will change every year, but with the Medigap Plan N, that doesn't matter. Your supplement will pay for it. Without a supplement, you pay the deductible up front, then have 60 days of hospital coverage before you start having a copay or coinsurance. With the Medicare Supplement Plan N, you can be an inpatient in the hospital for more than 365 days with 100% coverage. You'll have no out-of-pocket costs for your Medicare Part A. You should already know that with Medicare Part B pays 80% of your outpatient services. That leaves you a coinsurance of 20% that is your responsibility out of pocket. And there's no maximum out-of-pocket limit on that. Thankfully, your Medicare Supplement Plan N covers that 20% coinsurance so that you'll have no out-of-pocket after you've paid the Medicare Part B deductible. That's the $183 calendar year deductible. The amount changes every year. It's $183 in 2017. We'll talk about what to expect with that deductible in the years ahead in just a moment. So what do these asterisks mean? You notice that none of the other insurance plans have an asterisk. So this is an important feature that is unique to Plan N. The asterisks indicate that you have a copay with Medicare Supplement Plan N. Now that copay is up to $20 per office visit and a $50 charge if you go to an emergency room. But the key words here are up to $20. And here's what that means. For many common office visits with your Medicare Supplement Plan N, this copay will be less than $20. I've seen it as low as $9. So don't expect it to be exactly $20 every time you go to the doctor. But when you go to a specialist, I'm sure it'll be $20. In fact, what this is actually you're paying 20% of the office visit up to $20. Medicare's negotiated these office visits down, so most of the general practitioner office visits are, can be less than $100 to maybe $100. Of course, the specialist visits are going to be over $100, and 20% of that is going to be $20. So expect it to be under $20 most times, but it'll be up to $20 per visit. You'll notice on this Medicare Supplement Plan N, going down the column here of its coverage, you've got 100% coverage until you reach the Medicare Part B deductible. That's an annual deductible, currently $183. And you're going to pay for that out of pocket, but it also has no insurance for Medicare Part B excess charges. If you have a Medicare Part B excess charge and you have a Medicare Supplement Plan N, you will pay that excess charge out of pocket. Later in this video, I'm going to go over in detail a real-life example of having a Medicare Supplement Plan N and a common joint replacement. And what we're going to do with this real-life example is answer most of the misunderstandings and the questions that people have on what exactly the Medicare Supplement Plan N covers. So that's a little later on in just a moment. So we mentioned the Medicare Part B deductible is currently $183 in 2017. That deductible will go up over time. Medicare itself has hinted to expect it to go up to $250 perhaps in the next 5 to 7 years. And of course, every Medicare supplement that's purchased in 2020 and beyond will require that individual, the Medicare beneficiary, to pay the Medicare Part B deductible. Please note that preventive care, also known as wellness visits, are exempt from any of the copays and deductibles. If your first visit to the doctor, for example, during the year is a preventive care wellness visit, either your Welcome to Medicare visit or an annual wellness visit, it's entirely exempt from your Medicare Part B deductible and any of the copays. So what about these Medicare Part B excess charges? How much are they? Well, this can get a little bit involved, but it's very important, especially if you're considering a Medicare Supplement Plan N. When a doctor or hospital decides to work with Medicare, they have one or two choices with their contract. They can either decide to accept the rates that Medicare assigns or charge more than what Medicare advises. If they accept the rates that Medicare assigns, it's called Medicare assignment, then Medicare becomes their one-stop biller. You come in for a service, they bill Medicare. They don't bill your Medicare supplement. So they bill Medicare, Medicare pays its portion, and then Medicare will contact your Medicare supplement company and instruct them what to pay and when to pay it. So they don't bill your supplement company, and that's important. If a doctor or hospital decides not to accept Medicare assignment, then Medicare will pay them 5% less. Medicare will not be their one-stop biller, and they can charge up to 15% more than what Medicare pays them. And the amount that they charge that is more than what Medicare pays them is called a Medicare excess charge. Excess charges are only allowed on Medicare Part B outpatient services. There are no Medicare excess charges for Part A. When you have a Supplement Plan N, any Medicare Part B excess charges come out of your pocket. But here's the good news. Part B excess charges are very easy to avoid. And here's how. Paying excess charges are easily avoided by simply going to a doctor that only accepts Medicare assignment. When you're going to see a doctor for the first time, go onto the Medicare.gov website and look them up. The Medicare.gov website will tell you whether or not they accept Medicare assignment. If they don't accept Medicare assignment and you see them and you have a Plan N, expect an excess charge. If they accept Medicare assignment, they can't charge you an excess charge. Warning. Do not call up the doctor's office and ask them if they accept Medicare assignment. The odds are that the people at the doctor's office, as good as they are at what they do, won't really know what you're talking about. In today's day and age, most doctors' offices do not even do their own billing. So I can't tell you how often this type of scenario is what happens. A client of mine will call up the doctor's office. Do you accept Medicare assignment? I have a Plan N. The people in the doctor's office have no idea what they're talking about, and so they'll ask, well, what insurance company do you have? And they'll tell the insurance company. The doctor's office will look up on the wall at their list of companies that they have a Medicare Advantage plan with and say, well, it's not there. We don't accept your insurance. That's where the confusion is. All doctors that accept Medicare accept all Medicare supplements from any Medicare supplement insurance company. That's worth repeating. All doctors that accept Medicare accept all Medicare supplements from any insurance company. Remember, most doctors don't even bill your Medicare supplement. They bill Medicare. Medicare controls that, communicates to the Medicare supplement company, and tells them what to pay and when to pay it. And by the way, if you're researching companies to find out which one is good, think about that for a minute. Medicare tells them what to pay and when to pay it. There is no negotiation. There is no debate in there. Regardless of how that insurance company may behave in other insurance products, when it comes to a Medicare supplement, you will not find a company that doesn't do exactly what Medicare instructs them to do. So here is how you avoid the confusion. Get on the internet, go on to Medicare.gov. Now in that search bar up on the top here, you type in Physicians Finder. You go to your first choice, and here you can type in the name of the doctor, the name of the medical group, or actually search by doctor specialty. And right under the name of the doctor or the group, it will tell you whether or not they take assignment. If they take assignment, they cannot charge an excess charge. If you have a Medicare Supplement Plan N, you want to see doctors that take Medicare assignment. How many doctors take Medicare assignment? Well, according to Medicare, 97% of all the doctors in the country accept Medicare assignment. 97%. And that 3% that don't, that includes pediatricians. And if you're seeing a pediatrician, you probably don't qualify for Medicare. Bottom line is, most people go through their entire Medicare experience without ever running into a doctor that charges excess charges. But it can happen, and it takes extra effort to make sure that it doesn't. As far as individual hospitals, there's another question. What if I'm in an operation, as maybe my doctor won't charge me an excess charge, but what about the anesthesiologist? Well, remember two things. One is that if it's an inpatient operation, that's Part A, and there cannot be any Medicare excess charges. Of course, many operations are done on an outpatient basis, and here it's when you work with getting an operation in a hospital, it's an all or none situation. Either all the doctors working through this hospital will accept assignment and not charge an excess charge, or none of them do. Now, I can't profess to know all of the hospitals out there, but I have done enough looking, and the only one I can find that will charge an excess charge is Mayo Clinic. So if you have a condition or something that concerns that Mayo Clinic is the best bet for you, and you're going to go to Mayo Clinic, if you have a Medicare Supplement Plan N, they will charge you an excess charge. It'll be up to 15% more for their Medicare Part B services, and you will not have insurance against it. Now, there are also some states that absolutely forbid or severely restrict excess charges. Now, these states are called, we call them mom states, because the state laws that forbid excess charges or severely restrict them are called the Medicare Override Measure, abbreviated to MOM. If you live in one of these states, then none of the doctors in your states or hospitals can charge an excess charge. And that's important. That changes the equation about Medicare Supplement Plan N. So the states we're referring to that will either restrict or forbid excess charges are Connecticut, Massachusetts, Minnesota, New York, Pennsylvania, Ohio, Rhode Island, or Vermont. Those states have laws that make Plan N an even better value than Plan G. Now, if you are a resident of those states, but you travel a lot, you go out of state, just remember that when you're out of state, you can still experience an excess charge. But in those states, that's not going to happen. Let's go back to the Medicare benefit table, and I'll show you exactly how this changes the equation for you. Note on this table that your Medicare Supplement Plan F and Plan G both pay for any excess charges. That means they're charging you for that extra insurance. That's one of the reasons that Medicare Plan F and Medicare Supplement Plan G cost more. But if you live in a state that forbids excess charges, you don't need that extra coverage. You don't need to pay extra for that. Now that's some serious food for thought because it changes the equation for you. If you live in a Medicare override measure state, Medicare Supplement Plan N is more likely to be a better value than a Plan G or Plan F. So here's what I suggest if you're looking at the different supplement plans and debating which one is right for you. In some places, even in a Medicare override measure state, the Medicare Plan G is only a couple dollars more a month than the Plan N, making it a better value just because it's not really very much money. However, in a lot of places, the Plan N is 25 to 35% less than a Plan G. In that case, you really have to look at it this way. Both are good plans, but with a Medicare Supplement Plan G, you have a certain peace of mind. You can have your Medicare supplement. You don't have to worry about excess charges. You don't have any other copays. You pay your Medicare Part B deductible, and everything else related to Part A or B Medicare is covered. It's a sense of peace of mind. But it costs more. Medicare Supplement Plan N is going to cost less, typically 25 to 35% less, but it takes a little extra work. You have to check every time before you go to the doctor, and you have to make sure that you don't pay excess charges. And if you've got to go to a Mayo clinic, you either find an alternative or pay the excess charge. So it's really two personalities there as well. Some people prefer to have that complete peace of mind. Some people would rather pay less and don't mind taking the little extra effort to do that. Which one are you? There's one other point that you should consider when you're researching your Medicare Supplement Plan N, and that's Medicare Supplement Plan D. Have you looked at a Plan D yet? Take a look at this. Notice with the supplement table that Medicare Supplement Plan D is exactly identical to the Medicare Supplement Plan N, except it doesn't have the asterisk. That means that Medicare Supplement Plan D is exactly like Plan N, except you do not have a copay. You don't pay up to $20 per office visits, and you don't pay $50 for an emergency room visit. But here's the catch. Medicare Supplement Plan D should cost between a Medicare Supplement Plan N and a Medicare Supplement Plan G. But as I make this video in late 2017, in most states, the Medicare Supplement Plan D is simply not priced competitively. Sometimes it even costs more than the Plan G. Now, the reason for this is really many reasons. There's a couple here. The first being there's been low demand. Quite honestly, when you're talking to people and you're talking about a Medicare Supplement Plan D, it's too easily confused with Medicare Part D. And I can understand why. Medicare did a great job of finding the names for the different parts of Medicare that were very, very descriptive. So Medicare Part A, for example, is much more descriptive than simply saying in-hospital coverage. Or Medicare Part B is much more descriptive than saying outpatient services. All right, enough. But here's the thing, is that as we approach 2020, insurance companies are starting to take a look at the Medicare Supplement Plan D. Some have already started to reprice it in some states to make it more attractive. What's expected is that Medicare Plan D, your Medicare Supplement Plan D, even I can confuse it talking about these things. Medicare Supplement Plan D may be the supplement that will replace the Medicare Supplement Plan C as that's discontinued. For now, In most places, it's not priced competitively. In some places, it is. So as you get your Medicare supplement quote, ask the independent insurance agent that you're working with to check the Plan D. At least check to see if it's the right price for you. And even if it's not now, if you're reshopping this plan in your early 70s, as you should, it may be a better price for you then. So to wrap this up, let's take a look at a real-life example of using Medicare Supplement Plan N. And in this real-life example, I'm choosing a person who has gone to an orthopedist and needs a hip replacement. And what this example is going to do, hopefully, is not only answer the frequently asked questions, but probably resolve some of the misconceptions that people have about the copays and such with Medicare Supplement Plan N. So here's it. You go to your orthopedist, you have a Medicare Supplement Plan N. The orthopedist says you've got to have a hip surgery. Well, you've already researched your orthopedist before you went, so you know the orthopedist takes Medicare assignment. If they take Medicare assignment, they cannot charge you an excess charge. So that means that other than your Part B deductible, everything is covered as you've met your orthopedist a couple times and getting ready for the hip replacement. And when you have a hip replacement, you're going to spend a couple days, maybe 3, in the hospital as an inpatient, and that's typically where you have your operation. Being in the hospital and your operation is Medicare Part A. Part A doesn't have any excess charges. It's not going to have any copays. So your operation and the physical therapy you get while you're in the hospital, getting ready to walk and get out of the hospital, is all covered on Medicare Part A. When you have a supplement plan N, that shouldn't cost you anything. So then you're discharged from the hospital. You're going to have in-home physical therapy for a short while, and then you're going to have to go off to a physical therapist. There's a lot of physical therapy. Well, guess what? The physical therapy, that's not a doctor's visit. There are no copays when you have your physical therapy, whether it's in your house or you're going off to the physical therapist to have it done. You will have another copay as you have a follow-up visit with your doctor. That's very likely to have a copay with that. So if you've managed your doctor ahead of time in making sure that they take Medicare assignment, that Plan N offers a pretty good value. Warning number 2, if you are billed for a copay with a physical therapy visit, somebody has coded your visit incorrectly. It does happen. It does happen. I can help with that. I help my clients with that all the time. So yes, sometimes you're billed incorrectly. Medicare billing is rather complex. If it happens and you want to fight it, it's an easy thing to correct. I hope you found this information helpful. If so, please give it a thumbs up. If you've learned anything in this video, give it a thumbs up and let YouTube know that this is a video that's worthwhile for people researching Plan N. And what that'll do is make it easier for them to find this video when they have the same questions about Medicare that you do. In addition, if you want to see more of my videos, then subscribe to my channel. That'll make it easier for you to find my other videos. Now it's your turn. I make these videos for you. So please leave me a comment down below. Let me know what you found most useful or what you found most shocking about this video. I'm really interested in what you have to say, and it helps me to make better videos for you in the future. I'm Matthew Clausen at MedigapSeminars.org. Thank you for watching.